On Thursday, December 14, 2023, ZAMI NOBLA, the National Organization of Black Lesbians on Aging, hosted the webinar, Together We Heal, COVID-19's Mental Health Effects on Older Black Same-Gender Loving Women. This event highlighted findings from the COVID-19 community research study led by Dr. Tonia Poteat and the University of North Carolina School of Medicine and Marianne Adams and ZAMI NOBLA. This thought-provoking panel discussed the mental health impacts of the pandemic and shared their insights and provided strategies for healing and wellness. This was a unique opportunity to engage in a meaningful dialogue that affects us all. The panelists were Dr. Tonia Poteat, Dr. Dionne Bates, Jowanna Tillman, Edonna Koon. And if these names sound familiar, it's because they all are former guests of the podcast. I'll be sure to leave links in the show notes to their respective interviews. The moderator of the panel was our esteemed Executive Director, Marianne Adams. This event was sponsored by BEAM, Black Emotional and Mental Health Collective. Let's listen in. Welcome to the ZAMI NOBLA National Organization of Black Lesbians on Aging podcast. We are your sound source for Black lesbian herstory. I'm your host, Angela Denise Davis.
Good evening, everyone. My name is Marianne Adams, and I am the founder and executive director of ZAMI NOBLA, National Organization of Black Lesbians on Aging. I'm honored to moderate tonight's panel discussion titled Together We Heal, COVID-19's Mental Health Effects on Older Black Same-Gender Loving Women. This event is more than a discussion. It's a crucial conversation about mental health in older Black same-gender loving women, a topic that's often neglected. The COVID-19 pandemic has profoundly affected our lives, especially in our communities, impacting mental health, social connections, and overall physical health. Our discussion is based on a community research study led by Dr. Tonia Poteat and myself. I want to take a moment here to recognize other members of our current research team that meets bi-weekly to offer their expertise and experience. Dr. Portia Hall, a health gerontologist who is located in New York City, and Jennifer Horn, who is a geriatric social worker based in Colorado. Robin Ashendon, graduate student at UNC Chapel Hill and graduate research assistant at Duke University, is complicated, y'all, is intimately involved with our day-to-day coding, analysis, and publications. A special shout out to two graduate students who have recently joined our team from the Departments of Gerontology and Nutrition at Georgia State University, Tatiana Spence and Osmo Olivia Lowry. Our panelists tonight, Dr. Tonia Poteat, Dr. Dionne Bates, Jowanna Tillman, and Edonna Koon, will offer their insights on the pandemic's impact on mental health and discuss strategies for healing and wellness. We aim to engage in a dynamic dialogue, not just to present our research, but we invite you to participate in the chat with your questions and comments, as your insights are crucial to this discussion. Thank you so much for being here. Let's begin this journey of understanding, healing, and empowerment together. Finally, I want to express gratitude to our sponsor of tonight's panel discussion, BEAM, Black Emotional and Mental Health Collective in Culver City, California. For more information, you can visit their website at beam.community, and we'll share the link in the chat. I'm going to introduce the panelists as they present. Our first panelist is Dr. Tonia Poteat, who is a professor in the Duke University School of Nursing. She's Associate Director in the Duke Center for AIDS Research, CFAR, their developmental core. She's also co-director of the Duke Sexual and Gender Minority Wellness Program. Her research, teaching, and clinical practice focus on HIV and LGBTQ health, with particular attention to the health of transgender communities. Her research attends to the role of intersectional structural stigma in driving health inequities and seeks to identify strategies to advance health justice. So let me just say that it's very rare for an LGBTQ nonprofit organization to conduct their own primary research. We're very lucky in that regard. We have been working with Dr. Poteat on our three data sets. The first one was she was at Johns Hopkins, and that's on Black lesbians and aging, understanding healthcare needs. The second data set is centered on sexual minority women and breast cancer. And she was also at Hopkins at the time, and then she went to UNC Chapel Hill. And the third one, COVID and same gender loving women, the effects of COVID-19 on same gender loving women. So Tonia has since left North Carolina and she's gone to Duke. So hopefully our goal is that we will continue to work with her. I don't know if that's her goal, but it's certainly ZAMI NOBLA's goal. And hopefully you will be seeing more primary research from us. So I present to you at this time, Dr. Tonia Poteat.
Thank you for that introduction. It has been my pleasure, honestly, over the years to be able to collaborate with ZAMI NOBLA. I think every community engaged researcher really desires as committed, knowledgeable, active partnership as we've been able to have with ZAMI NOBLA. So I'm very grateful for that. And I'm grateful to all of you for showing up tonight. I am not going to bore you to tears with the long academic presentation. So my goal is to really just spend about 10 minutes focusing on the mental health findings from our study and then engage in conversation with you all and the other panelists. So just to introduce the study, Marianne told you the key parts of it. It was a partnership between myself at UNC and ZAMI NOBLA. We were the co-principal investigators, which is a fancy title for responsible for the study. The study was actually much more complex than what we'll have time to present tonight. It included quantitative data like survey questions, as well as qualitative data like interviews and focus group discussions. Our overall goal was really to understand broadly the impacts of COVID-19 on our community. This presentation will focus on the focus group discussions, the qualitative data that were collected early in the pandemic between July and December in 2020. I don't know if y'all can remember back or if you blocked that period of time. It was a very specific time in the pandemic. It was before vaccines, if folks can remember that. And there was still debate around the effectiveness of masks. There were many conspiracy theories. There was lots going on at that time in the pandemic. There were 16 focus group discussions that we held with 102 Black same-gender loving women who were age 40 years and older. And this table just tells you a little bit about who the participants were. So I'm not going to read every single line to you. I'm just going to focus on the highlights. The average age of the women who were in the study was 57, but we had people who participated who were as young as 40 or as old as 80. Not surprisingly, the vast majority of people who participated identified as lesbians. Everyone identified as a woman, but people had the option to choose other gender identities, and about 4% had another identity, and about 3% identified as non-binary, genderqueer, gender fluid. We had an incredibly well-educated group of people participate. 41% had a master's degree, and almost 30% had a bachelor's degree. Looking at employment, 44% were employed and 31% were retired, and the rest were sort of divided between self-employment, unemployment, part-time, and receiving unemployment. Were very few people. In terms of relationship structures, 46% were single, 26% were married, and other included things like unmarried relationships and other configurations of relationships. And then in terms of who lived in someone's house, 43% of people lived with their partner, 21% lived with children. And again, you can see a variety of people live with friends, parents, other people like roommates. And about 36% of people lived alone. So those were the folks who took part in the focus groups. And some of you might have been those folks, and I'm grateful for your participation. What I'm going to do for the next 8 minutes or so is walk through 3 of the major findings. I'm going to talk about the mental health impacts of COVID-19, how people described it in the focus groups, the factors that they described as influencing their mental health, and some strategies that they use to maintain their mental health. So not surprisingly, most people talked about negative mental health impacts from the pandemic. They described stress about and fears about contracting COVID-19. They had experienced a lot of unpredictability about their health, about what was safe to do, about what was going to happen with their jobs and their income. People remember there was extreme shutdowns, so people were encouraged not to leave their homes, so people experienced a lot of social isolation. And they described negative impacts on their health, like undesired weight gain, and how those impacts on their physical health then in turn affected their mental health. We specifically in our first analysis focused on caregivers. So what you see on the right side of the screen are the 2 papers that we've published from these data so far, specifically focused on caregiving. One is a quantitative paper that uses the focus group data that I'm going to describe to you tonight, and the other is uses quantitative data, where I'm going to give you a peek of it tonight, but really not dive into that. So what we've done is that the mental health impacts were especially pronounced among people who were caregivers. They experienced increased stress because they had to protect both themselves and the people they were providing care for, and especially if they were providing care for someone with dementia or someone unable to make those kinds of decisions for themselves. There's a mental health toll from changing household dynamics, where there might be more people in the household than they'd anticipated, like family members who came to live with them, increasing the caregiving burden. And then other people experience extreme isolation while caretaking. So maybe they've been able to share the burden before, but then because of the pandemic isolation, they were no longer able to do so. And then the quick peek into our quantitative data, we found that about 28% of the caregivers reported having depressive symptoms. But if we look specifically at the Black caregivers in that group of people, 32% reported depressive symptoms. That's pretty high. That said, people did report some positive from the shutdown. So for people who could work from home and didn't have caregiving responsibilities, they really described having more time to rest, to sleep, to be creative, to care for themselves, to think about what they wanted for their futures and their lives. And this is an example of a quote from one of the participants who was 70 years old. She said, "I think I got some inner peace. I took time to listen to myself and realize that I think I'm living in the good ages and I'm happy." Next, I'm going to talk about some of the factors that people described as influencing their mental health. One of those things are their social categories or their intersectional identities, as we like to say in academia. Their mental health, the impacts of the COVID-19 pandemic on their mental health were shaped by people's race, their gender, their age, and their sexual orientation. People knew about and were beginning to hear about some of the health inequities that we still see in COVID-19 in terms of greater impact on people of color, greater impact on people who are older. And knowing about these increased risks negatively impacted people's mental health. There was also a really stressful racial political climate at the time. People remember the George Floyd murder by a policeman, and then that really intense racial conflict and protests that were happening around the country at the time, and that created a lot of stress as well. A 44-year-old participant described it this way. She said, "It's horrible for our mental health in terms of knowledge of the disparities of impacts of COVID-19 is having on us." And then a 55-year-old participant talked about the political climate and said, "I think if you're an individual who feels like being a lesbian is an isolating experience, being an African-American in this political climate has made you more inclined to isolation. You are more of those things now than you've had been when we had more options before the pandemic." People also talked about barriers that they experienced when seeking mental health care. They talked about discrimination manifesting as people dismissing their pain, denying them proper care, being stereotyped by white physicians. And all of these experiences also exacerbated mental health impacts. When people talked about the kinds of providers that they wanted to see Black, female, LGBTQ affirming mental health providers. And they found that difficulty in trying to find the kind of providers that they want was a barrier and a deterrent to seeking formalized mental health care. That said, people had a wide variety of coping strategies that they used during the pandemic. They journaled, they did painting and coloring, they described sewing and crocheting, reading more, doing puzzles, meditating, sound healing through music or other types of sound, and then physical activity like hiking, biking, yoga, things like that. People reported having online resources as being particularly useful in their self-care practices. People also described support, how important support was for them. Some people described having participated in mutual aid, either as receiving mutual aid or giving mutual aid to others in the form of food or economic support. Some people received governmental aid when that was available. And people use online resources for social support using Zoom, Skype, and Facebook to engage in social interactions with other people. And that really helped them to cope with their isolation. Telehealth was also prominent in the discussion. People talked about using telehealth for mental health, either by seeking new services that they hadn't had before and using telehealth to do that, or people who had already been receiving mental health services who transitioned from in-person care to virtual care. They described using telehealth as generally positive and felt like it enhanced their personal experience and eliminated some of the logistical barriers. So on the right-hand side, you'll see a couple of quotes. A 62-year-old participant said, "It's more relaxed, so I think liking it more this way than the other way." When they talked about relaxation, they were talking about being able to be at home in a comfortable environment instead of in an office. And then another participant described telehealth being a help because she didn't have to catch 2 buses to get to her primary care physician or her therapist. She was able to, again, stay at home and not navigate public transportation to get to those appointments. So that is the summary of the big picture of what we found in terms of mental health effects of the COVID-19 pandemic among Black same gender loving women. We know that there are profound impacts that last through today, and I'm looking forward to us talking more about that today. In terms of what's next, what participants said we need to do, and what we analyzed from what they had to say is that we do need more Black LGBTQ women in healthcare settings so that people can get the care from people whose experience reflects their own. Right. We need to prioritize the availability of technology and resources to create and maintain support, both in times of isolation and beyond that, really. Focus on capacity building and support for people who are most vulnerable, and assist in mutual aid networks. I think for me, and particularly, I thought it was really beautiful how I saw people reaching out and supporting one another, either through formal organizations or through informal networks. So I'm going to stop there and just express my gratitude for everyone who participated in the study and shared their stories. Obviously, we can't have research unless people participate, and I'm really grateful for that. And I'm grateful for Robin for her work and doing the data analysis and creating these slides. And Angela Denise Davis's name is not here, but she created the gorgeous graphics for these presentations.
Thank you so much, Tonia, for that enlightening presentation. Do we have any questions in the chat? While we are looking to see if we do, why don't I start off this Q&A with a question? Because you know me, I always have a question. So in your research, you've explored the intersectionality of race, gender, and sexual orientation in healthcare. In your presentation, you discussed the specific mental health challenges faced by older Black same gender loving women during the COVID-19 pandemic. How do these challenges differ from the broader LGBTQ plus Black communities?
Thank you for that question. I think in some ways they overlap in that all Black communities were hearing all this information about how Black people were dying more easily and were more likely to be exposed to COVID-19. And we were all experiencing this sort of racialized, very tense environment around the George Floyd murder. But I think for our community, we were also experiencing things that continued, like the sexism, in addition to the racism, the homophobia and transphobia. I think we didn't dive deep into this, but for many women, they felt like, I remember particularly poignant quote from a woman who described, especially her caregiving experiences, that she felt like as a lesbian, her family expected her to do all of the caregiving, right? So she had to carry this caregiving burden that was associated with both her gender as well as her sexual orientation. And they felt like the rest of the things going on in her life were not important. So I think all of those things intertwine, like all of these systems of oppression really impact how our community experience the pandemic.
Thank you. Are there any questions in the chat? And let me just say that if you don't want to put a question in the chat and you just want to talk, you can certainly unmute yourself and you can do that.
Hi, I'm wondering what has been the long-term effects of COVID in terms of mental health. Thank you.
I don't know if that's a question for me or Mary Ann.
It's open to either.
Okay. I haven't seen data specific to our community. Mary Ann probably has because she's, I think, on the board or has been on the board of TEAM. We know that there's been devastating and long-term mental health impacts that don't even get talked about. We just sort of, everybody wanted to get back to normal so quickly that I think we haven't really given ourselves the time and the space that we need to address the exacerbation of mental health problems that were pre-existing and new problems that occurred because of the pandemic. And that makes me really sad. And when I do hear people talk about the sort of mental health crisis in this country, they talk about very young people, which is crucial and really important. But they don't talk about us. And we know for a long time that aging is one of the risk factors for suicide attempts. So I think our community could be more visible. And I hope, I'm really glad that we're doing this tonight and that so many people have shown up.
Let me just say that if you all have any additional questions or comments, we're going to come back at the end once all of our presenters have gone, and we'll have a general discussion. So please continue to put your questions in the Q&A because we really want to make sure that we answer as many as we can. Thank you so much, Tonia. So next, we have Edonna Koon and Jowanna Tillman. They are a travel-loving couple. They started full-time RVing in early 2018. Adventure is their calling. Edonna is a retired Marine who has a passion for science. And Jowanna used to work in higher education and has a passion for healthy living. And so they have, since that's been 3 years, they've been on this journey in this RV around the country. And we thought it was particularly enlightening for them to come on this evening to talk about the effects of mental health on their travels during COVID and beyond. So we're really excited to have them with us. Edonna, Jowanna, who wants to go first?
I'll start and then Donna can jump in. So we have been full-time RVing almost 6 years now. So COVID for us was in particularly difficult because as a full-time RVer, most full-time RVers don't have homes. We are not homeless, we are houseless. We choose not to have a property or any of those other things. Our home is where we park it. And the COVID pandemic was particularly difficult on us because as states started to shut down, they started shutting down public lands and campgrounds. So we were caught in Nevada when the hard shutdown on the country happened. And we were very lucky that we were on Nellis Air Force Base at that time because the commandant realized that he would be putting us out into the woods. And he knew that most of the people there were full-time RVers. So they didn't let any more people into the campground, but anyone who was there could stay as long as they wanted to. So we were able to stay in Las Vegas until the world opened up again. But you can imagine if, as a full-time RVer, we only had one air conditioner at that time. We got there in March. We didn't end up leaving until June. It was quite warm when we left. So that very much impacted not just mental, but physical health. I can say during that time period, we both had COVID very early in the process. We had, even before they had tests, when we got sick, we were in San Diego when we got COVID. We went to the Naval Hospital and the only question they asked us is if we had been to Wuhan, China. We didn't realize until later in the year that we had both had COVID because we were tested and they found that we had the antibodies. So that's when they figured out that's when we picked up COVID. I know for myself, COVID created major anxiety. And at that point, I hadn't gone to therapy. I didn't start going to therapy until later in the fall, but it was quite difficult. So I'm gonna let Donna chime in, see if she wants to fill in some holes.
Well, because we were having to move from one place to another after we left Nellis, when we got to San Diego and figured out that, we were really, really ill. The care that we got there at the base was very, very nice. In fact, being a veteran, you can call a nurse's helpline, which a lot of people don't have. So we were able to call the nurse's helpline, and she told us to immediately go to the hospital and told us which one to go to. So in that vein, a lot of our care is a little easier than other people's were at the time. Jowanna was infinitely more, her sickness lingered. Mine was very, very mild compared to hers. And some of the information that we got, because no one had a name for it, it wasn't even called COVID-19 yet. Some of the information that we got was more along the medical, what to do medically, and wear a mask or stay in. None of that was told to us. So we did isolate ourselves, which did create some problems because we're already in an RV and our community is very small. So the community shrunk even more as we were trying to go through the pandemic.
Right. We were probably very early Zoom adapters, always going to Zoom parties, creating Zoom parties, going to D-Nice parties on Instagram. One thing that as a full-time RVer where we spent a lot of time, or at least I did, early in the morning or very late at night, since we were in Las Vegas working out, we were in a campground that had wonderful walking trails, so we could work out. We had a workout track that was outdoor. So unlike most people who gained weight during the pandemic, I lost weight because I spent all of my time in the woods. Because once the world started to open up a little bit, we went to Yellowstone and we stayed in Yellowstone for the entire summer working. And all I did was spend all of my time hike. If I wasn't at work, I was hiking. It was very difficult because during those George Floyd times, most of the people who camp are white people, and we were working in a campground, and they felt very much empowered to call us very nasty names, tell us that the pandemic was a fluke. We were how people spoke to us was just that. By the time we got out of Yellowstone, I knew I needed to go to therapy because at that point I was done with white people, and I felt very much afraid of bodily harm. And so we're on our way back to Texas. And for me to for us to find therapy is different because we need to do things virtually. And so I typed in Black female therapist in Texas. And lo and behold, the website came up. And my therapist, she's in Austin. And where we normally stay is around Canyon Lake. That was before we had property. Now we own some property. That was one of our coping skills, was to get a little piece of property for us to retreat to if we need to, if there's any other kind of pandemic, because we don't want to ever be stuck where we don't have some place to go. But that's in Hondo, Texas. So those are the coping skills and things that we had to put together. And I would just say that from the anxiety, our medical doctor did not take my illness very seriously, and they weren't sure if I had long COVID because I continued to get sick and I continued to get sick, and she would not look up my nose, and I kept telling her, I can't breathe, I can't smell, I can't taste. It's been a year. This is ridiculous. And she's like, no, you just have to wait. It takes a long time. And I'm like, but I can't breathe. And so luckily I have insurance, so I don't have to listen to her. I just went and made a specialist appointment. But during that time in the pandemic, people forgot how long it took to get to see a specialist. If you need to see an ENT and you don't have an established ENT, it takes 3 to 4 months to get an appointment. And by the time I got in there, he decided, I was there the first day, and he's like, you need surgery. He's like, oh my God, he's like, you have polyps. They're horrible. You have fungus. There's stuff going on in there. He's like, why didn't your medical doctor? I'm like, she kept telling me I needed to wait. And so literally that was in October of 2020. They finally were able to fix my polyps May of this year. So that's a long time. And so also my lungs never fully healed from having COVID. And so January of this year, I had spots on my lungs that they couldn't figure out what they were. They finally just healed. So they were trying to figure out if I needed to be in a long COVID study. Do I have long COVID? Are they related? Are they not related? Which really slowed down our traveling, which of course, then you're going crazy. So at this point, I have a new primary care doctor. And as we said, we're in Texas. Finding primary care in Texas is very difficult. They're around San Antonio. Hondo is a small town outside of San Antonio. There's not enough primary care doctors, and there's only 2 Black primary care doctors in all of San Antonio. So right now my doctor's a Latina because the 2 Black doctors are so far away on the other side of town, it's not worth trying to drive over there. But believe me, I looked it up, and then I found a Black doctor, and she's like, oh yeah, there's only 2. But there's doctors, but there's just not Black doctors. So we lived in Atlanta before that, every single one of my doctors was Black except my neurologist, and I used to call him my token white man. And so it's very different than what we've had. But I would say that I feel like my anxiety is under control. I feel like I got my health back under control, and that really we have to take our own steps, because Donna and I, this pandemic kind of changed us. It's like every day we take our blood pressure, we check our blood sugar, we take our own weight. We're tracking all of our own numbers, because I'm not waiting on a doctor to tell me I have high blood pressure or that this is wrong or that is wrong. I'm trying to check it all myself. And then when I go to the doctors, I say, here's what's happening. Here's what's happened in the past couple of months. So I can have better conversations with the doctor. And I found doctors that I can do virtually. So from the pandemic, it's funny, other things, I had diabetes in my 40s, but I was able to go into remission by losing weight, exercise. Once I had COVID, next thing I know, the diabetes is back, crazy, uncontrolled. I have high blood pressure, never had high blood pressure before. So my whole body just didn't necessarily recover very well from COVID, but I feel like I've got a good handle on it now.
Jowanna's was completely different from mine because I didn't have any, during COVID, any fear of people. Mine came once we recently went back to work. I decided that I needed to talk to someone about the fact that I literally just wanted to grab white people and throttle them. So it was probably a good idea to go talk to somebody before I actually did it. And when I looked I went through a veterans program to find a psychologist or a psychiatrist. And I told them that I wanted a African-American female. And because I guess their pool is so low, they hooked me up with one person, and she, who was African-American, could not do anything for people who weren't literally physically in the state of Texas, which I was not. So she could not help me. So they gave me another one, and she couldn't do anybody that lived in the state of Texas, even though I gave them all of this information. So it took about 2 months, to get to talk to somebody. And finally, they gave me a Latino woman who had no clue. It was though she was living in a bubble. I could not understand the anger that I had for white people. And I had 3 sessions with her, and I had to tell her goodbye. So I did come away with 1 or 2 coping skills, one of which was just to distance myself for a while, because when we were working in Yellowstone, it's an all-white kind of situation. It was really bad. And I've used those coping skills myself to work through some of this, but trying to find Black female, even if they're not lesbian or same gender loving, it's difficult. It's difficult, especially if you're doing it through telehealth.
So I don't know if you have any questions for us, because we can ramble on, because we're not professionals. We only can talk about what our personal experiences are through the pandemic. And I don't want to say that it's all bad, because like I said, I've spent more time in the woods riding my bike. Before we came over here this afternoon, I was riding my bike through Stone Mountain Park. So I try to be active every day. In fact, that's activity and eating well and making sure I get proper rest is my best medicine.
Yeah.
Jowanna and Edonna, thank you so much. We had you on here because your experiences certainly mirror the experiences of lesbians who participated in the focus groups during the early stages of COVID. And so we have you on here because you aren't academics. And it's important. No shade to the academic, the 2 academics on the panel, but we had you on here because this is really, really important, because it's relatable. And we really want to make sure that we have a well-rounded panel discussion tonight, reflective of most of the people that are certainly in this Zoom room. Do you all have any questions? We have a few minutes before we go to our next panelist. And I don't want to be hogging up the room asking the questions. So please, if you don't want to put a question in the chat, certainly unmute yourselves and ask away.
Hi, thank you so much for sharing. I've been experiencing what you experienced, and I've been pushed around. Oh, you need to go see them. You need to go see them. I know I have long COVID. How did you get them to run that test? And how long after? My first time I had COVID was a month and a half. That's how long I had COVID in 2021. So how long after you had COVID did they do these tests to find out that you really had long COVID?
We had COVID in February of 2020. And so it was October, November of 2020 when they started running tests.
Wow.
Yeah, it was a while.
It was a while, because really, I just thought I had a bad flu. Because it was right there on the edge, and I hadn't been to Wuhan, China. And, we learned more as the pandemic
went along.
Mm-hmm.
And we had just come from a very large gathering. And in that large gathering, a few people afterwards had gone on Facebook and some other social media networks and said that they had, been experiencing this, and this. And it became a collective thing. So obviously, it was one of those things we all shared at this gathering. But it took a while before anybody actually said that, oh, that's what you had, back in February was COVID.
Thank you. Yeah, my test is not until January. And since having COVID, I've had it 3 times. I have an autoimmune disease. I've had kidney stones. I have a hernia. And that's all. But now my test will be in January to see. So thank you for sharing. I appreciate you.
Yeah, just make sure you keep on top of them, because at this point, like I said, I walk in with the data, with my own data sheets when I go into the doctor, and she just knows now. And so I feel like I'm getting much better care. And like I said, I'm very fortunate. I have the type of insurance. I don't have to wait. So I will call a specialist and say, I'd like to have a consultation or I want an appointment. And then I'm trying to bring all my medical records when I go to that doctor, just so I can get better care. Because I want them to realize I'm not just depressed. Because yeah, maybe I have some depression, but I'm just not depressed. Something is going on and something's not right in my body.
Thank you.
Jowanna and Edonna, your platform, JodoChasingRainbows.com, provides a space for sharing your diverse experiences traveling around the country since 2018. Can you discuss how storytelling and shared narratives can be powerful tools for healing and tenacity among older Black same-gender loving women, especially in the context of the isolation and the stress that have been brought on by the pandemic?
Sure. This past summer, I actually just wrote a blog post about it about 2 days ago, about 2 hikes that I did this summer that challenged my ever-loving body. And I tell a big story about it because one of them, I was on a 15-mile hike. And at the end, because I was so tired, I was sitting there going, I'm just going to hold to go into the bathroom instead of going behind a tree because there's a vault toilet in 3 miles and that'll be my reward. That was the stupidest thing I ever said. And once I realized how dumb that was, I went behind a tree, went to the bathroom and kept trucking. But when you get to see the beauty, when you finally finish a hike, especially a 15-mile hike. A 15-mile hike is on, especially when there's hills. But we saw thermal features. I got to see a baby snowshoe hare, which are very hard to find in Yellowstone. When you get to see that beauty, when you get to encompass that, when you get to get that smell, because when you're close to the road, you're going to smell cars and everything else. When you're in that backcountry, and it's you and just maybe the 2 or 3 people you're hiking with, that's an experience right there. And then your body when you get back, because I can tell you that 15-mile hike, I was not prepared for the next day not being able to move my body. So I think doing that, finding the story, and then finding the commonalities with other people who may have not be able to do it, because sometimes I feel like I'm doing some of these things, especially when I'm doing something that's kind of a little bit crazy. I'm doing it for everybody who can't. So then I got to tell a good story because I want them to come along and I want them to feel, smell, see what I did. So if you can't go, I'm taking you with me.
We've talked to some people that help with their isolation. Just being able to go and see the pictures and the videos and tell the stories of what we've been doing. A couple of them have even talked about going to do that once they could get back out again. And it was nice to see people outside because they were in more urban areas and couldn't do things like that they were able to share in our experiences and through the storytelling of helping them. And it really helped them with some of their isolation.
I have a question. I'm sitting here and the advocate in me is going crazy as you're talking about this doctor who completely just ignored your needs. Was she a Black woman? And how did that conversation go afterwards? Did you just like ghost her, or was there any kind of like confrontation, I guess? Not confrontation, but has she been held accountable?
She was not a Black woman.
Jowanna does not do confrontation.
I'm not going to do confrontation with you, but I did let the office know that I would no longer be a patient and that I found another doctor. Now, what I did do is I let her know, because she even tried to hold up my surgery because she wouldn't clear me to have surgery. Because I went for an appointment. She's like, well, I haven't seen her since last week. I don't want to clear her. And he's like, do you understand how bad this is? The doctor was like, I would do surgery tomorrow if my surgery schedule wasn't already filled. That's how dire it was when he saw me. He literally called my insurance. He's like, no, you're not leaving. I'm calling your insurance because I want to do a head CT and I want to get you cleared for surgery because this is where you are. He's like, at this point, your nasal cavities could completely collapse. He's like, you could be done. We may not be able to fix you. She didn't want to look up my nose because it was COVID. Remember, this is October 2020. I don't know if in Texas, this is one thing that I miss about my Georgia doctors. My Georgia doctors would touch you.
In Texas,
I don't like when your primary doctor doesn't touch you because there's something in touch that's very important. It tells you about somebody's soul, their spirit, what vibration they may have. And she never wanted to touch you. She would put her stethoscope on you to listen, but she wouldn't even put, some doctors will touch you on the back of your shoulder while they're doing that. She wouldn't touch you at all. And so she was a doctor that I got when I first moved to Texas because they said she was a good doctor. And I realized after 2 visits, she wasn't a good doctor. I only kept her because we were traveling and I needed my high blood pressure medication. But during that whole time, I was looking for a new primary doctor.
Yeah, we had the same doctor, and I was a little more confrontational with her, and I told her why I wasn't coming back to her, and we definitely started looking. I just dropped her. I didn't even have another primary. I wasn't going back to her.
Yeah, so I don't know if I can answer your question real well, but that's basically how I had to handle it with her because we were traveling, but I don't know. And I understand that COVID changed a lot of medical professionals too, and some of them became so fearful that they weren't going to do a lot.
Yeah.
And I'm not saying that's good or bad. I'm saying it is. And we saw a lot of that when we were in San Antonio. A lot of doctors just
they
pulled back.
Yeah, they really pulled back, and it was a situation where she's still practicing. I know she's still practicing. So I mean, nothing ever happened.
Thank you so much, Jowanna and Edonna. Please continue to put questions in the chat. We will have some time at the conclusion, once Dr. Bates has finished, to engage more comments and questions. Thank you all so much. Next, we have Dr. Dionne Bates. Dr. Dionne Bates is a licensed professional counselor with a PhD in clinical psychology, and she has over 20 years in clinical practice. She's the author of the self-solstice, self-affirmation model, and works with her clients to help them reach optimum mental health by teaching them to affirm themselves, affirm others, and live an authentic life. She is a member of the Licensed Professional Counselors Association of Georgia, and she's a certified professional counselor supervisor. And she's our community therapist. So I bring to you Dr. Dionne Bates.
Oh, thank you so much, Marianne. First and foremost, I want to say thank you to ZAMI NOBLA for this space. Thank you, Dr. Tonia, and to Edonna and Jowanna. First and foremost, let me just say that I am really, really, really sorry what you all had to experience, not only in Yellowstone, but also with your physicians in Texas. No one should have to experience that. But I'm very glad to know that you all got and are continuing to get the kind of care that you need, that you feel you need, and that you continue to advocate for yourselves. So thank you very much for having me here. So one of the things that I just want to kind of chime in, to be quite honest with you, Jowanna and Edonna, they pretty much said everything that I was going to say this evening. Their experience really highlights a lot of what many people, excuse me, experienced during COVID. And when we start talking about not just the intersectionality of race, gender, identity, and sexual identity, that oftentimes Black lesbians face. In the mid to late 90s, a Black psychologist by the name of Beverly Green, who I think came out of St. John University. She may even still be at St. John's University. But she talked about a type of triple jeopardy that women who identify as Black lesbians face in terms of the societal oppression. And when we think about the results that Dr. Tonia highlighted for us in the study, and we think also about some of the stories that and the experiences that Edonna and Jowanna talked to us about, I think that those stories and those results certainly help to confirm that elder Black lesbians face what a quadruple threat, being race, gender identity, sexual identity, as well as age, when it comes to a range of challenges with regards to their optimal mental and emotional functioning and development, particularly during COVID. My practice, I probably see maybe 3% of my population may fall within the population of elderly Black lesbian women, which is a very small population. But what I would also say is that at the height of COVID, the work that I did with this population probably seemed to be the most significant, because some of the issues that Jowanna and Edonna talked about, I had quite a few of those in that population experiencing the same thing. So not only isolation, so being isolated from family, being isolated from community, but also experiencing, physical symptoms, and sometimes having the hypervigilance or the anxiety that whatever they were experiencing may have been connected to COVID. I think there was also the other part of, with the isolation, having more anxiety just because not really sure about, whether or not COVID was going to go away. Well, COVID has not gone away. We've just had to learn how to deal with it. And so that was a part of treatment. How do we help you to learn how to deal with this, but also deal with it in a way that is going to help you to feel more comfortable, not just giving up your entire life to a disease that a lot of people just, we were still trying to figure out. I think the other piece too is that when it came down to lesbians who identified as Black lesbians and elders, one of the things that we had to look at was just kind of their health care as a whole. So some of what, a lot of what I was doing was helping people to realize that, number one, you have a right to advocate for yourself with all of your healthcare providers. And for some individuals, that was somewhat foreign because, we go to the doctor and, we pay them because we do pay them. Some of us pay out of pocket, and that's a lot of money. But, individuals who are our healthcare providers, they are not the last answer. You do have a right to ask questions. You do have a right to get a second opinion because it is your health. And so some of what I was doing with them was teaching them how to advocate for themselves. And more than that, helping them to realize that, yes, this is a right that you have to advocate for yourself. And just kind of being that support system for them as they are going through the process of learning how to advocate for themselves, helping them to understand that a lot of what it is you are experiencing mentally and emotionally in terms of the elevated depression, the elevated anxiety, the having panic attacks that they've never had before, considering where we are with a disease and being in a pandemic, because as Dr. Tonia was saying, we were really in a dual pandemic when you think about the high levels of COVID, but also the racial tensions that were happening across the country. And so all of that was kind of was kind of a quiet storm brewing for a lot of us. And so when you think about individuals who are marginalized, some of those issues seem to be a little bit more heightened. But I think also it was important to try to normalize what they were feeling, considering what was happening in our country at that time. I think the other piece to that too is what I found in terms of assisting this population in going through a dual pandemic, because that's what it was, is, in some ways kind of thinking outside the box. And the therapy that I do is oftentimes very unorthodox, but ethically sound, which basically means that I just believe that sometimes therapy cannot just take place within the confounds of the four walls of an office. And so at the height of COVID, I was seeing more people. Now, there were a lot of therapists who stopped seeing people in the office. They went completely telemental health, which is fine. I think that telemental health is beneficial for a lot of people. There are a lot of benefits to telemental health. I was fortunate enough, however, that I did not have to close down my office. So for clients who felt comfortable coming into the office, we just made accommodations so that they would feel safe, I would feel safe. If they felt like, if they wanted me to wear a mask, I would wear a mask. If they didn't have one and they wanted to wear a mask, I would offer them a mask. We did all the hand sanitizers, we opened the windows, but also what I did, because again, a lot of people had gone into isolation and they were inside and afraid to go out. Some of the things that I started doing was, rather than you coming into the office, I would have them to meet me, say, at the river is really close to my office. I'd have them, hey, meet me at the river and we'll just go for a walk. We'll stay outside. And it also gave me the opportunity to really work with clients in terms of some authentic grounding work, being outside, touching the ground, touching nature, being one with nature, and learning how to meditate and breathe in that way. Something else that we did with a lot of these clients is we started talking about meaningful activities. So as Jowanna was talking about hiking and riding her bike, some of the individuals that fall within this population, we talked about, some of the things that brought meaning to their lives, that would help them to be able to ground themselves more and center themselves when they started, really kind of having the anxiety and and those depressive symptoms started to rise. The other piece that I think was really important is that I spent a lot of time educating people about the fact that just because you have a mental health condition, it does not mean that you are mentally ill. And so trying to remove some of the stigma around some of the influx of what they were feeling emotionally and mentally. I think one of the things that's really important that I think sometimes people don't necessarily get when going in to see a counselor or a psychologist or a psychiatrist or a social worker is just kind of educating them about, what is depression, what is anxiety, and that, yes, you can experience sadness, you can experience anxiety, and it doesn't necessarily mean that you have a mental health condition. And so just kind of going through the DSM, which is what we use to diagnose people, and just kind of helping people to understand what is a depressive condition or depressive disorder, and that there are certain symptoms that have to be present in order for there to be a specific disorder, and that when those symptoms start to change, the diagnosis also changes as well. So a lot of what I found myself doing was probably educating a lot more during the height of COVID, particularly for my clients who fall within these demographics, being elderly Black lesbians, and those who are caregiving. As I was looking at the results, one of the things that I noticed that the results talked about was, not just caregiving with regards to parents, but also caregiving with regards to children. And one of the things that I had the experience of when I was in my predoctoral internship, I was in Huntsville, Alabama. And one of the things that just really struck me then was that a lot of the clients that I saw were probably, 50, ranging somewhere between 50 and 70, 75 maybe. And these individuals, these ladies, now I'm not quite sure how many of them identified as lesbian, but what I will say is that these ladies were caregiving not to their children, but these were grandmothers and great-grandmothers who were caring for their grandchildren and great-grandchildren. And so with regards to the population that we're talking about this evening, I think one of the things that's really important is, that I found myself oftentimes doing is really trying to help them shift the way that they were looking at caregiving, whether it was with their children, but even more so with a parent, particularly a parent. Maybe the parent was going through some sort of whether it was dementia, whether it was Parkinson's, but a parent who was, really dependent on that particular person. Because what happens is we have two identities. One, we have our identity as the person that we're caring for as their child, their adult child. But now we also probably feel as if, okay, my parent has really become my child. So we're also talking about the stress of that and what that looks like, and the idea of having to care for your parent who is completely dependent on you, and having a difficult time trying to put it in your mind that, okay, yes, this is my parent, but right now I am my parent's caregiver, and I have to be more of a parent to them at this point in time. And so, helping people to really kind of think about and cope with some of the guilt that they may have, helping people who have had very challenging relationships with parents, deal with the stress of and sometimes the resentment of having to care for a parent. I think the other piece too is, in doing that, helping individuals to think about what kinds of support systems do you have in place. Again, as Dr. Tonia and Jowanna and Edonna pointed out, at the height of COVID, people were very, very isolated. And so, whereas you may have been used to going to people's houses, them coming to your house, you may have been used to people in your house leaving so that you were not having to be under them for 24 hours a day. And for some people, especially for my clients who were either introverts or extroverts, and the people in their household being the exact opposite, there were a lot of challenges there. But just trying to help people to understand that, you can take time for yourself. As a matter of fact, it is important for you to take time for yourself, especially if you are an introvert like I am, and you find yourself in a household of people who are extrovert. You have to try to reconfigure the boundaries and figure out what it is you need in order to be as emotionally centered as you possibly can. So those are just some of the experiences that I had at the height of the pandemic with some of the clients that fell within the demographics that we're talking about this evening. Anyone have any questions or concerns for me?
I have one, Dr. Bates. Well, we're looking to see if there are questions in the chat. We talked about certainly ways that individuals can support themselves mentally, and Jowanna and Edonna gave some really good examples of kind of getting through some of those issues that were very difficult and challenging for them. I'm wondering, from your perspective, as a professional counselor for the last 20 years and dealing with a diverse clientele, um, in what ways can healthcare providers and policymakers and community organizations better support the mental health of older Black same-gender loving women, particularly in the context of these ongoing challenges with COVID-19?
Sure. So I think one of the first ways that healthcare providers can assist is, number one, getting out of their own way. One of the things that I think is really important when you're dealing with any marginalized community, and again, we have to acknowledge and lift up that for same gender loving Black women who are elders, again, we're talking about race, gender identity, sexual orientation, as well as age, that puts us in four different marginalizations. And so one of the things that's important is, number one, the client or the patient is the expert on themselves. They have lived with themselves for however long, and you, in terms of the healthcare provider, you have just met this person and have spent maybe 5 minutes with them. And so one of the things that's really important, I think, is that taking time to really listen. And because I think that if we can consider all of the different ways in which people are marginalized, and the ways in which we do that partly is to listen and to listen for understanding, it can help us to develop new perspectives and understandings of their lived experiences and what they are experiencing coming into the office to see the healthcare provider. One of the things that I also think is important, and just from the work that I do, number one, I tend to work from several different lenses. We are not a monolithic people, and no one type of therapy is going to work for every person. But one of the things that I try to do in terms of conceptualizing what's happening with the client is that from a feminist perspective, they are always the expert on themselves, and they always have a choice. And I think that that's really important when you're talking about a population that for many of us, choice has always been taken away from us. And so allowing people to understand, yes, you do have a choice. And if you don't understand that and you don't know that, a part of the journey with the healthcare provider is being in space and holding space for that person, I think, to really think about the choices that they have. Some individuals don't realize they have choices. And that's why I'm always a proponent of helping people to advocate for themselves when they are talking to healthcare providers. The other thing, too, that I think is important when we're talking about marginalized communities is looking at helping individuals to find meaning and determine the significance of their lived and living experience. Some might call that existentialism. I would probably call it existentialism, but I think it's a really important component, and it can be very empowering to people when you hold space for them to think about meaning of their experience, and be able to help support them in that meaning as they're exploring, because the meaning can change, and that's okay too. But just allowing them space to have permission to explore what certain attributes mean to them, or what certain challenges mean to them, and try to come to some sort of a resolve on their own.
Thank you so much, Dionne. That was really, really empowering. Do we have any questions in the chat? We have about 14 minutes left.
Yes. I was wanting to know what's the best way to advocate for yourself with your doctor when you find yourself repeatedly asking for like lab testing. I'm a veteran. I go to the VA, and it's like sometimes I have to pressure them to give me certain lab work. So what's the best way to, just repeatedly ask them the question, or what?
Donna would like to answer that question.
I go to the VA, and I understand how you're having to navigate that. And the problem is you're going to have to constantly tell them you want those tests. And the reason, honestly, that they don't want to give you that test is because of money. It's not because, they think that you're asking for something that you don't need. One, they may not think you need it, but they know that once they give you that test at the VA, they have to pay for it. You don't necessarily pay for it. So that is one of the reasons why, unfortunately, a lot of my medical care does not happen at the VA. They're very, very bad with women, period. They have just started to do things with women in the last maybe 10 to 15 years at the VA, and seeing us as actual veterans. So that stigma is already there with them. If you can, and you want that lab test and you can afford it, you can go to an outside lab and have it done if you want to pay for it. Or you can, get yourself an outside doctor. But I have found that just dealing with the VA as a female, and as a Black female, just leaving lesbian and 65 out, is a hurdle. And sometimes I just don't want to jump through all those hurdles. So I do go outside the VA, but that may be your best bet, because if they don't think you need that test, they're never going to give you that lab test because they have to pay for it.
Thank you so much, Edonna, for that. I don't think that I could have said it any better. I think, if you are, obviously, if you are a veteran and you're going to the VA, number one, you have served our country in some capacity, and you deserve to have the type of healthcare that is of quality. And I want to caveat what I'm about to say by saying that I recognize that there are some individuals who are limited in terms of the care that they can seek out. So to Edonna's point, if you only have the VA, you only have the VA, and you have to work within that system. But, certainly if you have the resources and you have the capability, I would encourage you to seek treatment outside of the VA. There's nothing wrong with you getting a second or third opinion. I think the other piece too is I've actually had clients who've come in and who have said, I've advocated for myself, and I'm glad that you're encouraging me to do so. My doctor's refusing to give me this particular test, or they're refusing to do this, that, or the other. I actually have clients who have said that they have started, when their doctors refuse to do tests, or they refuse to provide a treatment that they feel like they need, they have started telling their doctor to write in their notes that they refuse to give they're telling the doctor to put in the notes that they are refusing to give the test after the patient has asked for it, so that there will be a record of the patient requesting the test. And if something happens, then it has been documented. So I don't know if that's something that might be helpful for you as well. Dr. Tonia may be able to lend more of a voice to that, because I'm not a medical doctor and I can't talk on medical things. But again, you have a right to advocate for yourself. I'm not a veteran, but I am the queen of getting up off a table if I feel like a doctor's bedside manner is not what I need it to be. My motto is, if it don't feel right, take flight. And there have been times when I have been on a doctor's table. I can tell you that I ended up having a hysterectomy in 2012, and it took me going to 4 different gynecologists to finally find out what was wrong with me. And it was extremely stressful, very depressing. And, you know, thankfully, the last gynecologist that I went to, who is still my gynecologist, her nurse sat there and listened to me for over an hour. And then she came in and she listened to me for 45 minutes the first time I went to visit. And so she was finally able to tell me what was wrong with me. And my condition, I have PCOS. And so it was just, and I'm not a textbook case of PCOS. And so people were having a hard time. The doctors I was seeing before were having a hard time trying to figure out what was wrong with me. And so I say that to you because, you know, if you're not feeling right about the care that you're getting, you have a right to seek care other places. Again, I don't know what your financial situation is. We certainly don't want you to have financial distress and end up with a heightened level of emotional issues because of that. But certainly, I think it's to start investigating whether it's TRICARE or whether it's an insurance that you can get through the marketplace. I was just in the marketplace. Yes, some of the deductibles are high, but you can get insurance for like $20 to be able to go see someone else. So I think that might be something that you may want to start thinking about if that is feasible for you, because you deserve to get the kind of care that you that is of quality, particularly since you have helped to defend our country.
Thank you, Dionne. Tonia, do you want to speak to that?
I was about to type it in the chat, and I'll be brief because I know we're running short on time. That if any time a healthcare provider either offers you a test or refuses you a test, they should be able to explain to you why in words that you can understand. And if they can't explain why, then I think you deserve somebody who can justify what they're doing.
Thank you, Tonia. We have about 6 minutes. We really want to respect everyone's time. We have just one little closing comment from each of our panelists. In addition to thanking you all for these amazing presentations, we want you to know that we don't want to be the kind of organization or academic that just collects data. We want to make sure that we report back what we found. We appreciate you all taking part in this data collection, because without you, we wouldn't be able to do the work that we do. And so we are committed to holding these forums at least every 2 to 3 months to report back. We have quite a bit of data on caregiving. We've been really surprised about what we're finding. And so the next presentation will be around caregiving sometime, hopefully in early spring. And then after that, perhaps nutrition, but we have a lot of data. And so again, and we also have a lot of research questions that we really want to examine as well. So one last question that we have to the panelists is, what message of hope or empowerment would you like to leave with our audience this evening? Jowanna and Edonna, you can start.
I would like to say that especially to the veteran, continue to advocate for yourself, and to all, same gender loving women. If you don't advocate for yourself, nobody else will. Just stick to your guns, advocate for yourself. I know it may be difficult. I'm an introvert, so sometimes that doesn't help, but continue to advocate for yourself. And there is a light at the end of the tunnel. There really is.
Dionne?
Just to piggyback off of what Edonna said, you have a right to advocate for yourself. You have a right to heal. All of us do. It is our birthright. And when it comes down to the effects of COVID, And for some individuals, I heard the sister on the call talking about long COVID. I have a couple of long COVID clients as well. And so when it comes down to the mental health effects of COVID, long COVID, there is healing in that. You're talking about the healing of your body. You're also talking about the healing of your emotions, the healing of your mind, and thinking about how those things intersect. There's an intersection there. It's really important to not only advocate for yourself, but also believe that you can heal. Believe that just because you are experiencing some sort of some emotional symptoms, it does not necessarily mean that you are quote unquote mentally ill. When we think about the heightened level of depression and the heightened level of anxiety at the height of the pandemic, those things were normal occurrences for anyone who ended up with COVID or who were just impacted by COVID, whether they had to take on more responsibilities at home or more responsibilities at work. And so sometimes it's important that we normalize what's happening with individuals so that you have an understanding that, okay, yes, I'm experiencing this, but this is not the end of my world. I can get through this. And I just want to leave those words to empower the people that are on this presentation that, you can do this. And I think it starts with advocating for yourself, but also educating yourselves on the fact that, yes, I'm experiencing this, but this is normal based upon what is going on right now.
Thank you, Dionne. Tonia?
I want to say thanks for inviting me. And thanks for letting me participate. It's been an amazing discussion. So thank you for everybody who asked questions and for all the other panelists. I just have one suggestion in terms of thinking about in the context of advocating for yourself. One of the ways that I do that is bring a friend with me. I'm a healthcare professional. And when I go see another healthcare professional, I bring a friend so that if I forget to say something, if that provider is scary for some reason, I have somebody with me. So that leads into my last sort of message of hope that we have each other. We are here. What stands out to me in terms of what people said helped them and their mental health through the pandemic, some of it was quiet time alone. We all need that. But a lot of it was taking care of each other. And we can take care of each other. And we have been for a long time.
Thank you, Tonia. And that certainly leads me to the fact that we are stronger together. Nobody's going to save us but us. I'm very clear about that. We have an organization. We need to coalesce. We need to do this movement work. We need to affect policy. We need to go in 10 strong. And certainly that's something that we can do. We're trying to build these state chapters all over this country. We need your help in doing that so that this is not an individual problem. This is an organizational issue. This is a community issue. This is a state, local, and federal issue. Because right now, we're invisible. And we need that visibility. We need that representation. We need that collective voice. They may not listen to one. They might not listen to 5. But guess what? They'll listen to 500, 1,000, 5,000. We can do this because ain't nobody going to do this but us. So there's one thing that I want to leave you all with. It's advocacy. We have to advocate for ourselves, and we have to do it as a collective, as an organization, as a unit. Thank you all so much. It's been very heartwarming to see all of you, some faces I haven't seen for a minute. So we really, really appreciate you all taking your time tonight because you could have been anywhere and you chose to be with us on a Thursday night. It is Thursday night, right? So again, thank you all so much for coming out. We really, really appreciate this. And again, we couldn't do this research without you. We couldn't do anything without you. So continue to participate in research, particularly when it's by us, about us, and with us. Say that again, by us, with us, and about us.
One of the great things and unique things about ZAMI NOBLA is our commitment to community action research. If you'd like to find out more about our other research studies and publications, then visit our website. Thanks for listening in today. Your listenership means so very much. And while you're taking a look through our directory of other episodes, why don't you leave a review and a rating? It means so very much. Thanks again. And as always, have a sweet one.
Hey.